You know, these days we're talking a lot about mental health, more than ever, and addressing issues that most people never even thought to share or treat decades ago.
Yeah, but many are still struggling. Well, Forest View Hospital, here to help children and adults, inpatient and outpatient. There are so many options depending on what you and your family needs. Nicole Floyd is the Director of Clinical Services joining us this morning. Nicole, thank you so much for being here.
Thank you for having me.
First, give us just the overview of Forest View and all of the work that you guys do there.
Yeah. Oh, I don't know if I can about that. We do a ton of stuff. So we have inpatient hospitalization. So anybody who's in an acute mental health crisis, we're able to house them for a short period of time, restabilize them, get them back out into the community. We have the opportunity for our patients to step down to or just straight admit to our outpatient services. We have partial hospitalization, so that way they can still live at home but receive like a decent amount, like 6 hours a day, 5 days a week of group therapy and other like coping skills, safety planning, things like that. We have IOP, which is 3 days a week for 3 hours. And then we also have our medication clinic next door to our main building. And so that way people can receive psychiatry services as well.
It sounds to me like it's not a black and white thing. You've got a lot of different levels of customization to meet people where they're at. Let's talk a little bit about that, though, the specialization. I mean, there are certain things that you kind of hone in on.
We do. So on an inpatient setting, we actually hone in on 2 tracks. So we have our trauma track. So people who have a significant amount of trauma, which everybody does, but there are some people that would benefit from group therapy about that. So we talk a lot about biofeedback. How does my body feel? What is my body responding to? And educating our patients on what exactly trauma presents like. So that way they can identify it and then learn coping skills for it. We also have our eating disorder track, and that is for inpatient and outpatient. We're able to manage that both in person and on Zoom. So we get patients coming from all over Michigan, sometimes other states, to admit to this program. So that way they're attending to their mental health distress as well as their eating disorder. So since it's a co-occurring thing, we might as well work on those things together.
Wow. Okay. Well, let's talk about the overarching impact on the community, having these services available for people who need them when they need them most.
Yeah, it's really rare to find a program that has the eating disorder specialty, especially for a short-term stay. A lot of them are either residential or outpatient, so this is a good middle ground for those things. It's a good way for people who have a significant amount of trauma or were recently triggered by a traumatic experience to come in, kind of reset a little bit, learn some new skills, and go back out into the community. So I think that it's a great place for people to come, kind of get some rehabilitation. That way they're not committing themselves to a 30-day program. They can still get back out into their lives. If they're assessed for the level of care of being outpatient, they can still come get some intensive services, but continue to live with their loved ones, get support in that way. And then on both sides of those continuum of cares, we're in contact with their family members as well.
Excellent. And you say we are in contact. Let's talk about the we. Let's talk about the teams that you have at Forest View.
We have amazing teams at Forest View, and I'm not just saying that. So the inpatient clinical services team, they are the reason that keeps me there. So I spent a lot of time building and cultivating this team that I felt like would be most beneficial to not only the hospital, but the community that we serve. So they're a group of impassioned individuals, different licensures, but all kind of in the therapist realm, so social workers, licensed therapists, psychologists. And we have that on both the inpatient and the outpatient side. And they are limited license to full licensure. So they're the ones really doing the work. I just kind of help them out and answer some questions from time to time, but they're the ones on the ground and they're on the front line.
Okay, and so then what can we do and to help ourselves and to help our families, work on our mental health? Because I think it's something that we all should be working on every single day, no matter where we are in our journey.
Definitely. I think, we as a society, we've done a great job recently. But we really need to continue to move forward to get rid of the stigma that mental health is like this taboo thing that we shouldn't talk about. Everybody has mental health. It's just how well it is that varies, and it's on this spectrum. And so the more that we can talk about it, engage with one another about it, and recognize that we're not all sitting in the same place, meeting each other where we're at in that journey, I think that would be kind of the first step with that. So family members, natural supports that people have, if they can just recognize that their loved one may be in distress, and allow them that space, make space for them to talk about those things, and say it's okay and encourage them to get help at one of these facilities, whatever facility it may be. I think that would be some really great first steps.
Absolutely. And easy to take that first step. We can get a phone number on your screen pretty easily, and there it is, 616-942-9610. If that's you, that's where you're at, good place to call. Or you can always just find more information at forestviewhospital.com. Thank you so much for the time this morning.
Thank you for having me.